A whole grain is a cereal grain that contains the germ, endosperm, and bran, in contrast to refined grains, which retain only the endosperm. Common whole grains include wheat, oat, barley, maize, brown rice, rye, millet, quinoa, amaranth, triticale, teff, buckwheat. Common whole grain products include whole wheat flour, whole wheat bread, whole wheat pasta, rolled oats or oat groats, triticale flour, popcorn, teff flour. Common refined non-whole grain products include white rice, white flour, white bread, hominy, pasta. Identifying whole grain products. Whole grain products can be identified by the ingredients list. Wheat flour as the first ingredient is not a clear indicator of the product's whole grain content. If two ingredients are listed as grain products but only the second is listed as whole grain, the entire product may contain between 1% and 49% whole grain. Many breads are colored brown and made to look like whole grain when they are not. In addition, some food manufacturers make foods with whole grain ingredients, but, because whole grain ingredients are not the dominant ingredient, they are not whole grain products. Contrary to popular belief, whole grains are not indicative of fiber. The amount of fiber varies from grain to grain, and some products may have things like bran, peas, or other foods added to boost the fiber content. In Canada, it is legal to advertise any food product as whole wheat with up to 70% of the germ removed. While the resulting product will contain the benefit of fiber in the nutritional information, it lacks the nutritional content found in the wheat germ. Canadian consumers can be assured of whole grain products by a label stating 100% whole grain whole wheat. Similar to the distinction between whole and refined grains is that between whole pulses and refined dal. From AACC definition, whole grains shall consist of the intact, ground, cracked or flaked chiopsis, whose principal anatomical components, the starchy endosperm, germ and bran, are present in the same relative proportions as they exist in the intact chiopsis. U.S. Standards of Identity. The following names indicate whole grain products, in accordance with the federal government: whole wheat bread, whole millet, whole wheat buns, whole wheat macaroni, whole wheat spaghetti, whole wheat vermicelli, cracked wheat, crushed wheat, whole wheat flour, graham flour, entire wheat flour, brominated whole wheat flour, whole durum flour, bulgur. Canadian Standards of Identity. There are multiple grains such as cereal grains as well as pseudo-cereals that may be labeled whole grains. When wheat is milled to make flour, the parts of the grain are usually separated and then are recombined to make specific types of flour, such as whole wheat, whole grain, white cake and pastry flour, and all-purpose white flour. If all parts of the kernel are used in the same relative proportions as they exist in the original kernel, then the flour is considered whole grain. Under the Food and Drug Regulations, up to 5% of the kernel can be removed to help reduce rancidity and prolong the shelf life of whole wheat flour. The portion of the kernel that is removed for this purpose contains much of the germ and some of the bran. If this portion of the kernel has been removed, the flour would no longer be considered whole grain. Health and whole grain consumption. In a 2002 study, consumption of whole grains was found to be associated with lower fasting insulin concentrations when compared to those associated with the consumption of refined grains. This effect, as well as improved insulin sensitivity, was noticeably more pronounced among obese and hyperinsulinemic subjects, suggesting whole grain consumption may be an important component of reducing risk factors for type 2 diabetes when only compared to the consumption of refined grains. Consumption of whole grains has also been consistently linked with a significant decrease in risk factors for cardiovascular disease. Regular whole grain consumption lowers LDL and triglyceride levels, which contributes to an overall 26% reduction in coronary heart disease risk factors. In addition, whole grain consumption is inversely related to hypertension, diabetes, and obesity when compared to refined grains, all of which are negative indicators in total cardiovascular health. Keeping grains as close to their original form as possible slows or prevents the digestion of starch, and a slower digestion is responsible for preventing spikes in blood sugar. See also, archylrosacinols, uniphenol, wheat germ, wheat brie, Whole Foods, whole grain stamp, whole wheat bread, references. External links, article from BBC News, definition of whole grain, tips for preventing insulin resistance, US FDA guidance on whole grain label statements.